Good afternoon and welcome to our Farmers Community Forum. The following is a presentation detailing the importance of the choices that you as farmers make towards the type of pastures you utilise in different seasons. A lot of farmers that we have spoken to over the years have voiced concerns about the serious epidemics associated with ryegrass and phalaris toxicity. The devastating economic and animal welfare impacts that these diseases have are a definite reason for us to be concerned. Perennial ryegrass toxicity, for example, has caused 5 widespread epidemics in southeast Australia. In autumn 2002, an estimated 100,000 sheep and 500 cattle died during the perennial ryegrass toxicity event in Victoria alone. In Western Australia, annual ryegrass staggers cost the livestock industry $40 million per year. Phalaris aquatica is a hardy plant that is highly drought tolerant. Toxicity resulting in a nervous syndrome is uncommon, but the risk is highest in cobalt-deficient soils or where conditions lead to low cobalt availability. This is preventable with cobalt supplementation. It is important to recognise the environmental conditions that are of highest risk for toxicity. Late season rainfall followed by hot spells during the summer and autumn are a major concern. A major problem encountered by farmers is that by the time they recognise the clinical signs of toxicity in their herds, the plant responsible may no longer be present on the pasture. As well as the typical stagger signs, animals may suffer from ill thrift, heat stress, scouring, lowered fertility, and aggravation of existing foot problems, all of which can reduce overall farm productivity. In addition to this, there is virtually no tolerance to the toxic component of annual ryegrass in the export hay industry, a component of the $1 billion Australian fodder market.
Perennial ryegrass staggers tends to occur in late summer and autumn when the rains begin. The pasture is dry and short with little growth. The ryegrass must be infected with a fungus called Neotyphodium lolli, which infests most parts of the plant and produces a toxin called Lolitrim B. This toxin affects sheep, cattle, and horses, and young animals are more susceptible than old.
Clinical signs associated with perennial ryegrass staggers occur 7 to 14 days once cattle begin grazing toxic pasture. They begin with fine and coarse tremors exacerbated by movement, especially in the head, neck, shoulders, and flank. This progresses to head nodding and jerky limb movements. The limbs move without flexion, resulting in a stiff, bounding gait. Cattle fall into lateral recumbency with head extended and back arched. They experience tetanic spasm. If left undisturbed, animals may recover. However, animals may repeat clinical signs when driven or stressed. 5 to 75% of animals are affected. Mortality is rare and primarily due to misadventure. Mortality. Diagnosis is based on clinical signs, season, climate, and by animals showing recovery on removal from pasture. Treatment. Animals should be removed from the toxic pasture immediately. Recovery will usually occur 1 to 4 weeks after removal. Excitement of animals should be minimized to reduce the number of affected stock that collapse. If removal from toxic pasture is not an option, stock can be confined in temporary drought lots or small sacrifice paddocks or laneways with a safe water supply, shade, and supplementary feed. Collapsed animals should be moved to sheltered yards or sheds if possible and provided with shade, food, and water. Animals should be harnessed or positioned so they are sitting upright rather than on their sides to avoid regurgitation of stomach contents and aspiration into the lungs. A risk management plan should be prepared on properties with perennial ryegrass dominant pastures in winter rainfall areas, particularly where perennial ryegrass toxicity has previously caused major problems. Farmers should monitor livestock closely during risk periods for early signs of toxicosis, such as staggers, so they can be moved onto safe pastures or feedlots. Grazing management, topping, and fertilizing can increase the legume component of mixed grass clover pastures to reduce the dominance of toxic species. Pastures can be grazed for shorter periods to reduce the intake of heavily infected parts of the pasture. Farmers should complete all essential animal handling procedures before the high-risk period for perennial ryegrass toxicity in the summer-autumn period, Endophyte or toxin-free pastures are available, but these tend to be less tolerant of insect pests and drought, and can become contaminated with wild ryegrass in a few years.
Annual ryegrass staggers occurs in late spring and summer, when the pasture is mature. The ryegrass must be infested with a nematode, Anguina funesta, which insists in the seed heads, creating galls. The nematode carries a bacterium called Rhaeobacter toxicus, which replicates in the gall, producing a yellow slime containing tunica mycin-like toxin. This toxin persists in hay and affects sheep and cattle.
Clinical signs associated with annual ryegrass staggers occur within 2 to 7 days of exposure to toxic pasture. They involve coarse tremors and head nodding, and may progress to a stiff-legged, jumping or swaying gait. Animals may collapse into ventral or lateral recumbency. In ventral, often the hind limbs are in a posterior extension. If lateral, opisthotonous limb extension, tetanic and clonic convulsions predominate. Affected animals may recover, but are usually still ataxic. Animals will fall into lateral recumbency and exhibit opisthotonous, nystagmus, dyspnea, and tachycardia. Mortality can be high, and animals eventually die of terminal convulsions. On post-mortem, there is perivascular edema of the meninges, the liver is pale, enlarged and friable, and there is generalized congestion. Diagnosis will be based on clinical signs, the season, evidence of yellow slime on the plants, post-mortem findings, and the presence of infected grass seed heads in the food eaten. Affected stock should be removed from pastures and fed hay. Control measures should be implemented, such as post-emergent herbicides to control it in cereal crops, heavily grazing pasture while seed heads are still emerging in early spring, and burning of infected pasture. There are also biological controls that can be implemented, such as twisted fungus that inhibit the movement of nematodes to the ryegrass seed heads. This needs to be used every year for 5 years to maximize efficiency.
Phalaris toxicity can occur at any time of year, but peaks in autumn and winter, during the rains. The grass is in its active growth phase and contains high concentrations of alkaloids, which can cause the sudden death syndrome seen in Phalaris poisoning. The plant is more toxic if stressed, such as during heavy frosts or extreme heat. If the soil is deficient in cobalt, we can see the neurological form of the disease, staggers. Phalaris toxicity affects sheep and cattle, sheep being more susceptible than cattle.
Clinical signs associated with Phalaris toxicity do not occur until animals have been grazing from 9 days up to 11 to 16 weeks on toxic pasture. Clinical signs vary and may include hyperexcitability, head nodding, body tremors, ear twitching, splaying of the digits, and flaccid or rigid limbs. Ataxia may result in a proppy or paretic gait. Affected sheep will fall onto their knees and knuckle over. They will collapse after forced exercise and will eventually die. The less common sudden death syndrome involves laboured respiration, cyanotic mucous membranes, and animals suffer sudden collapse resulting in death. Diagnosis will involve history of access to plants in the stage of active growth, consistent clinical signs, and signalment. Post-mortem changes include generalized congestion and endocardial petechiation, and histopathology reveals green pigmentation of the neurons of the brain nuclei and corticomedullary junction of the kidneys. High-risk pastures should be avoided. This means not grazing stock during the period of rapid plant growth where the alkaloid toxin is in highest concentration. Stock grazing young Phalaris plants for the first time should be supplemented with hay to reduce their ingestion of the Phalaris plant. Cobalt can be used as a protective treatment for nervous syndrome, with animals being administered cobalt bullets as the most cost-effective method.
Periods of heat stress predispose livestock to developing a number of other significant diseases, and may also change the levels of toxicity of certain plants. 4 additional heat-related diseases are described here. Number 1. Paspalum toxicosis is caused by the ergot, Claviceps paspali, which grows in the seed heads under warm, humid conditions. Therefore, toxicoses often present after hot, wet summers. The animals present with neurological signs that progress to eventual paralysis. Animals recover upon removal from pasture, and incidence can be reduced by topping pasture to remove the seed head. Number 2. Summer fescue toxicosis affects cattle, sheep, and horses when grazing tall fescue seed contaminated with the endophytic fungus Neotyphodium xenophialum. Summer fescue toxicosis can present as reduced feed intake, weight gain, fever, tachypnea, roughened coat, and hypersalivation. Prevention involves destruction and replanting of a fungus-free pasture, or avoidance of pasture during hot weather. Number 3. Sulfur-induced polioencephalomalacia is caused by the increased evaporative effects of hot weather on water sources, leading to higher concentrations of sulfur in water bodies. This can be more pronounced in areas with naturally sulfur-rich soils. The tendency for increased water consumption in hot conditions also increases sulfur consumption from these water sources. Affected animals often present with severe neurological signs. Regardless of the cause of polioencephalomalacia, treatment involves thiamine administration. Prevention involves avoiding high sulfur sources. If this is not possible, gradual introduction to these sources is crucial. Number 4. Oxalate toxicity usually occurs in autumn after a dry, hot summer. This coincides with plants being in the leaf stage of growth. Alternate causes may be due to pastures dominated by oxalate-containing plants, such as Setaria species. Risk factors include pregnancy or lactation, newly introduced stock, or hungry stock. Toxicity presents acutely as muscle tremors, tetany, recumbency, or sudden death. To avoid toxicity, adapt stock to grazing oxalate-dense pasture over 4 days by gradually increasing exposure time.